Hey, good afternoon. My name is Terry Dietz. I am a student at the University of Texas at Arlington Master's in Nursing Administration program, and we are here today to interview our gracious speaker, Kathy Dawson, who is the Vice President for Patient Care Services and Chief Nursing Officer at Saddleback Memorial Medical Center in Laguna Hills, California. And for those of you not familiar with this geographic area, that's in South Orange County. So Kathy, thank you very much for helping us with this today. I appreciate it immensely.
Sure.
So I'd love if you would just start off and give them a feel for your management background and educational background and how you came to where you are today.
Sure, I'd be happy to. Well, actually, I graduated from a diploma program way back in 1975 and went to work immediately in pediatrics and went to a pediatric ICU after that. Really loved pediatrics, but then when I had my own kids, I decided maybe peds wasn't for me. So I switched over to adults and spent a large portion of my career in critical care and working as a critical care nurse in a couple of different critical care units. And somewhere along that line, in that time period, I decided I needed to go back to school and get a bachelor's degree. And so I went back and got a bachelor's in health science to start with. And then continued working in critical care. And as I was working in critical care, had the opportunity to be a charge nurse, which I really liked. It was kind of very different, but I enjoyed working as a charge nurse in critical care. Once again, decided I needed to go back to school and went back to get my bachelor's degree in nursing as well as my master's degree in nursing, and did a dual program at that time. And when I finished that program, I was a cardiovascular clinical nurse specialist is what I came out with. And but prior to that, as I was working in critical care, I had the opportunity to be a manager slash head nurse of an open heart surgery unit. It was a brand new unit that was just being developed, and so had the opportunity to help actually work with the architects to set that unit up, a 10-bed ICU, and then actually be the head nurse of that unit. And also within that time period, somewhere before I did that, I was
varied career.
Yes, varied career. Had the opportunity to do a brief stint as a case manager and discharge planner, which was very interesting. Kind of veered off the clinical path for a little bit, and came back. Also had the opportunity to work while I was in school in the cardiac cath lab, and that was really fun to do that piece of it. So I worked as a cardiovascular clinical nurse specialist for a while, and then became a director of education at another hospital when I changed jobs, and had the opportunity to then become the executive director of a heart center, and then a CNO actually in that same organization. So kind of worked my way up in the management structure, and had a really great time doing all that. Also, during my career, I had the opportunity, especially after I got my master's, to be an adjunct faculty at various universities. So not only was I an educator and a director of education within the hospital setting, I also had the opportunity to educate outside the hospital setting and actually do clinical rotations at several different universities. Great opportunity and experience. So, like I say, I've had a wide variety of experiences in my career. I've been in management for 20 plus years, and I've been at the executive level probably for about 12 years as a CNO or VP.
So along that path, you've been interventionalist, you've been an educator, you've been clinical. What really made you decide you want to veer into management and kind of stay that path?
A great question, because it's always a hard transition, I think, for all of us to make who really love bedside care and taking care of patients. And I did struggle with that initially. However, I realized, number one, I realized that you can make a difference even with patient care, even in management. So you're affecting it in a different way by being a guide, a mentor, a support for managers and others, or even for staff nurses who are actually taking care of those patients. So that was one realization that I had. The other one was at one point in my career where I believe actually before I became the head nurse at that open heart surgery unit, I had a wonderful mentor. And she was the director of critical care in the organization I was working in then. And she was one of those people who saw the possibility and the potential in me and really helped to guide and mentor and support me to go into management. And then she modeled exactly the kind of person that I wanted to be. She spent a lot of time with the staff, spent a lot of time with other managers and directors, and a lot of time with the patients as well, just making rounds. And so I think that's what really really helped make my decision to go into management and stay in management.
And you've been successful at it.
Thank you.
And I truly appreciate being the recipient of your mentorship now. So that's great. So I want to talk, this focus is on nursing certification. So I want to talk about your current personal certifications and how you made the decision to pursue that.
Sure. Well, currently I have a Nurse Executive Advanced NEA in BC, the board certified through ANCC.
Okay.
I've had that certification for, well, I just renewed, so what if I had it for 5 years then? And it's been, it's been great for me personally to have that certification because it validates for me that I have the skills, knowledge, abilities to do the job that I do as a nurse executive. I also feel like, and I haven't talked about this yet, but when I was president of the Association of California Nurse Leaders, to have that certification, again, really validated the fact that I was board certified as a nurse executive. And when I was introduced or when my name was put out there in a publication or some kind of communication, to have those credentials after my name, I think really helped others to see that I was, well credentialed and well educated and skilled to be in that position as well. I also just want to say one thing. I've always, for the most part, always had a certification. I hung on to my CCRN as a critical care nurse forever and ever and ever, even when I went into management, because it was so important to me. But when it got to the point where I truly could no longer get those clinical hours, it was like, it was hard to let go of, but I did, and that's when I switched over to the nurse executive. Which
is important because you felt it was important as a clinician as well as an executive. Absolutely important.
Yes.
Cool. So would you talk about, you've talked about the benefits that you felt you received from it personally. As an executive in our facility, how do you think that it benefits this facility to have our nurses certified, and how do the patients benefit from having certified nurses?
I think for the facility, it really benefits us to have certified nurses because, and I know there's not a lot of research to validate this, however, the thought and the feelings are that certification really does improve patient safety and improve patient quality outcomes. The other thing that certification does is to, it helps on a personal level for the nurses that have their certifications in their specialty area. It helps them to have a sense of pride and achievement and a sense of empowerment that they again, to going back to that knowledge, that skill level, those abilities to care for that population of patients. So all of those things, if you have nurses who are empowered, then they truly are going to feel better about taking care of their patients.
Absolutely.
And so those are definite benefits to the organization and to the nurses on a personal level as well. The patients and families, now, they may not know at this point that their nurses are certified. They certainly are benefiting from that extra special care and that high quality and patient safety that those nurses are providing for them.
I think some of the literature search that we had to do for this program, nurses that are certified are, as you discussed, have to do a certain amount of education to keep these certifications up.
Right.
And so I think what they have found, at least in studies, is that nurses are more apt to keep really good adherence to policies and procedures and protocols, and because they already have read the literature and understand really well what it takes, and therefore the patients will benefit from that expert care. So I think all of that will tie into great patient outcomes.
Absolutely. I think too that on a professional level, certified nurses in many organizations, most organizations, it provides them more advancement opportunities, whether or not there's a clinical ladder in place. I think if there's opportunities for promotion or other things, that we're most likely to look at those with certifications. First and foremost, for those kinds of advancements.
Shows a commitment to the profession.
Absolutely, that's a good point. A commitment to the profession. That's a great way to put it.
We
yes.
like that.
Yes.